Hello, I'm Ken Takino of the American College, and today I'm honored to be joined by Rebekah Barsch from Northwestern Mutual, and we're going to talk a little bit about retirement myths and retirement realities. Welcome.
Thank you.
Rebekah, do people overestimate or do they underestimate their life expectancy in retirement?
Well, most people state that they think they will live roughly 15 to 20 years in retirement. So the 65-year-old today has a 50% chance of living past the age of 87. That's for a 65-year-old man. A 65-year-old woman today has a 50% chance of living at least to the age of 90. So that would tell us that people underestimate how long they're actually going to live in retirement. It gets worse when you talk about married couples, because there's a 50% chance that at least one of the spouses will live past the age of 94. So overall, thinking about not planning your retirement income just to your life expectancy, but beyond, in case you are one of those people who exceeds the average and makes it longer, means you're going to need that income to depend on.
Rebekah, another issue that comes up is, are people prepared for the retirement lifestyle?
I think it depends on the approach that they take. So generally, you hear a statistic floated around that people think in terms of wanting 80% of the income they had when they were working for their retirement. And the answer is that enough? The logic that goes into guessing around that 80% is thinking about maybe the house is paid off, kids are out of college, they don't need to contribute anymore to a 401k, so some of those expenses may be gone. However, then you think about people wanting to take or needing to take into account that they generally pay more for health insurance in retirement, that they may want to travel more, they may want to do some things for their children or grandchildren, they may even be in a higher tax bracket, and they need to pay tax on all the money that they're now withdrawing out of their qualified accounts. So really the only way to figure out how much is enough for retirement is to sit down and do a budget and figure out what you think your expenses are going to be, both those essential expenses you have to pay as well as the discretionary ones that you could cut back on if you had to.
Okay, so the rule of thumb, 80%, when we're getting towards retirement, we really want to just sit down with our planner and scribe out a budget and make sure we know what we're spending, know how we're spending, and then we can plan for the amount we need.
Exactly.
Rebekah, another misconception I think people have, and we need to bring them to reality, is the concept that Medicare will take care of all my costs. And in other words, that since I have Medicare, I don't need to spend any out-of-pocket money for retirement. Is that true?
That's exactly right. We hear that all the time. So let's start with what Medicare does not cover. Medicare does not cover your insurance premiums for Medicare gap coverage as well as for prescription coverage. It does not cover vision, dental, or hearing expenses or co-pays, and it also doesn't cover most long-term care. So that is a big chunk of expense.
Sure.
In fact, the Center for Retirement Research out at Boston College estimated that your out-of-pocket medical expenses in retirement run roughly $4,300 a year for an individual and therefore $8,600 for a couple. And if you happen to be making more than $107,000 a year in income, you pay significantly more than that.
Right, because of the Medicare Part B premiums, I guess.
Exactly, they go up then. So I think the thing to remember in retirement, in addition to being sure you're budgeting for your out-of-pocket healthcare expenses, is that the inflation rate of healthcare expenses has, at least in recent history, significantly exceeded the regular inflation rate. So we always need to be planning that those healthcare expenses are not only going to be higher than we generally estimate, but they're likely to grow at a faster rate.
Wow. Rebekah, another issue about retirement is, I think people think, well, I can work longer, and that'll make up for any shortfall I have now. So why not live a little larger now, and so I can work a few years longer. Is that a realistic way to look at things?
That's right. When you're sitting down and looking at the realities of what your assets for retirement might generate, there are two things that come to mind if it doesn't look like it's going to be enough to support the lifestyle you want. One is that you could save more, but of course that's immediate pain and feeling that as an impact on your lifestyle while you're still working. And the other one, as you said, is, well, I'll just work longer. And the cold reality of that is that it sounds great when you're 50 and you're sitting down to do retirement planning, that you'll just work longer than the average retirement age. However, as you get closer and closer to retirement, the practical reality of being able to work longer often doesn't true up with what your expectation was given your energy level and your enthusiasm 15 years prior. So we know that the research group LIMRA did a study recently that showed that about half of the people that they surveyed retired before they expected to. So certainly some people will work or they'll continue to work part-time, and that's great. But to depend on that to be able to provide your retirement income is probably not a great idea.
Rebekah, that's great information. Thank you for coming.
Thank you for having me.
And thank you for watching.